Hi, my name is Logan Gushiken. I'm a physical therapist on DMOS's rehab team, and I wanted to take a little bit of time and explain dry needling and to see if it might be a good fit for you as a treatment approach, or if you'd want to come in and speak with one of our therapists or one of our physicians to get some more questions answered about what dry needling might be able to do for you. The premise behind dry needling is you're really looking at that nervous system, muscular system relationship. So your nerves, they go to the muscles and then they activate, which causes muscles to contract. And if that relationship is abnormal or dysfunctional, you might see a nerve that's activating a muscle too much, and that might give you what would be, in layman's terms, a knot or a trigger point or a tight muscle. If you have a nerve that's not firing when you want that muscle to fire in its entirety, it might feel weak. It might feel like it's kind of loose. And both of those can be treated by dry needling. And the premise behind the dry needling is you're putting input into the muscle, into that neuromuscular system, and trying to get a reset. So we would do dry needling to an area, just like we would maybe do hands-on or stretching or low-level exercise to try to get the same goal, and then we would follow it up with corrective exercises, or maybe there's some other therapist-driven techniques to try to get your pain down or your system under control. So to be able to do dry needling in physical therapy, I would have had to gone to a course where I get certified. And typically that involves book work leading up to a lab where we learn about the practice, we learn about the research that backs it up, we learn about what it looks like on paper before we work on people. And then we go to a course in person where all the muscles that we are able to do the dry needling on, we perform on other physical therapists, other people going through the course, and then we also have it done on us as well so that we know what it feels like, and we get really good experience knowing what you might be feeling as a patient. So we wouldn't be doing any muscles on a patient that we haven't had done on ourselves, and we're not asking you to do something that's novel to us as well. So I think that's important. Most certification agencies have different levels. So most have a level 1, a level 2, and then options where you can really specialize into pelvic floor maybe, or maybe targeting certain nerves that take a little bit more advanced knowledge of anatomy. But we have therapists in the DMOS system who are level 1 certified and level 2 certified. And in the orthopedic setting, it really covers everything that you would probably benefit from. So some patients experience pain. If a muscle is tight, that could be a source of pain. If you think, if I had my biceps contracted all day long, my biceps would hurt. To the same degree, if my biceps was contracted all day long, it would be really hard to reach up because it would be tight and limiting that motion. So really that neuromuscular relationship can affect movement, it can affect pain, it can affect your perceived strength. So when we're looking at why would I do dry needling, it can be to target any of those 3 reasons. Dry needling can be really helpful with tendonitis or tendinopathies, where a muscle that's tight could be putting extra stress on a tendon. So if you reset that muscle, sometimes that can help bring pain levels down and help that tendon to heal a little bit more properly. And similarly with bursitis, there are some really good studies that show dry needling is effective for individuals who are feeling chronic pain or pain in multiple body areas, and there are some different techniques to try to bring the system, your nervous system, try to calm it down and try to bring that pain response to a more appropriate level. If you are having a tight muscle that's affecting movement symmetry, it can be really helpful to calming that muscle down and making it so that your movement is more symmetrical or more efficient as well. But really, for the purposes of this video, I think it would be best if you are curious about dry needling, that you talk with your physician physician or talk with your physical therapist where they can answer those questions more in depth. You might feel an ache or a cramping sensation, and that's very appropriate and very normal. And sometimes the more dysfunction a muscle is having, the more of a response you're going to have as a patient. But it shouldn't be too much different from the pressure that you would feel from deeper pressure. The needle is not hollow. It's a very thin filament. It's flimsy, so you're not going to feel that typical needle pain if you've ever had an injection or a blood draw. Those are considered wet needles because they're injecting or pulling fluid. This is dry, and the needles are thin, they're lubricated, and they're sanitized, so they tend to weave a little bit in a very non-invasive way. It's not too stressful for the local tissue. And that's actually another reason why I like dry needling for certain conditions, especially if I'm working on a muscle that's deeper. I'm able to get to that deeper tissue without having to push through the layers that are more superficial. So I've actually found that it's a way to have less soreness for a lot of people because I'm able to get right to where I want to go. We do use the same needles that an acupuncturist would use, but the premise behind why we would do it and how we do it is very different. So acupuncture is more based off of Eastern medicine practices where they're looking at energy flow, different chi patterns, reflexive patterns that they would put the needle in certain areas to try to unlock areas where your energy might be blocked. And dry needling is much more Western medicine where we're looking at a muscle or a tissue that might be abnormal and we're trying to restore typical function. We might be looking at movement and say, yeah, it just seems like you're hung up in that muscle in your hip. It's just not moving the way that we would like. So I'm going to try to reset that muscle. And we're going to be going to different depths and different locations. There are some risks associated with dry needling. They're very uncommon, and we do what we can from a training perspective and a procedural perspective to minimize those risks. But you may experience some local skin irritation. You may have some post-session soreness. Every once in a while, if we hit a unpredictable capillary, which is just a really small blood vessel, you'll see a very small amount of blood. That's probably less than 10% of my patients. If we're working in the lung field, we have training to avoid this, but we do talk about it with patients where if we have a needle that would go into the lung field, then that could be damaging to that lining and actually cause pneumothorax. So regardless, if you're going to move forward with dry needling, I would recommend that you talk through the risks and think about the risks associated. Talk about it with your physician or your physical therapist. Okay, we're going to look a little bit about what dry needling would look like if you were to come in. So obviously we need access to the skin. So if we're working on forearm, we'd make sure that your sleeve is rolled up past the area that we're going to work on. If we're working shoulder, it's very helpful if you wear loose fitting sleeves or like a tank top. And what we would do is we take the needle out of the casing. This is stored in a sterile gas, and there's an expiration date for that reason. Helps keep the needle clean. We take the alcohol swabs, we clean the skin, and then we would also sanitize our hands and wearing gloves. This is to protect the patient, but also to protect us because we want to make sure that we don't get any blood, if there is any, on ourselves. Once everything is clean and draped, we would find the muscle that we're targeting. Say, okay, maybe there's a tight muscle here. So I would take it, I'd isolate the muscle, take the needle, and there, it's in the skin at this point. And to find the depth of the muscle, we just slowly insert. You feel that? Mm-hmm. You feel like an achy sensation. Mm-hmm. And there's different techniques at this point that we might use. We might try electrical stimulation. We might try a pistoning technique, is what we call pistoning, where we push forward in and out, and there. And that is at the therapist's discretion. And there are different techniques that we might try that would be more therapeutic for one reason and less therapeutic for another. But at that point, you know, it could be that quick. You could be done. And based on what we're working on, we may do some corrective exercises or stretches following to try to normalize that muscle function. But as you can see, there's no blood in this case, and everything is relatively painless as far as the needle insertion portion.